Stages of healing. Did you know that anytime you get injured or have a trauma to your body, that your body naturally has the ability to heal itself, and it actually progresses through different stages. So today's video, we're going to go over those different stages and what they mean and how you can support them clinically and also nutritionally. In today's day and age, we have no shortage of, prescription and over-the-counter pain medications. We have NSAIDs, we have cortisone shots, we have muscle relaxers, and then we have the prescription pain meds. While these do a great job of blocking pain signals, they don't actually enhance the body's ability to heal. So the question is, do you want to temporarily feel better, by blocking pain sensation, or do you actually want to get better? And I'm not saying these other treatments are bad. They obviously are good, especially, in the right circumstance. In fact, I just had, ankle surgery. I've been wearing a boot right here. So I am doing this video because I am showing you what I have done during my own stages of healing. And so in part 2 of this video, we're going to go over actually the nutritional factors. But I think it's important to know what's happening on the cellular level. So we're going to talk about the different stages of wound healing. We're going to go over what happens at each one, how I can support it naturally with different supplements, with different dietary recommendations. And I think this is important to know because your body's going through this every single time. And the field of physical medicine, with all the physical modalities, the Normatec boots, the cryo chambers, the different soft tissue therapies, there is no shortage of new advancements in the physical arena, but I really feel like the clinical nutrition aspect is often lacking. So thanks so much for joining into this video. If you like it, please share it with a friend. If you know someone else who needs this video in their life, share it with them. And we will talk about the stage of healing right now. Just to let everyone know that before I get started with the different stages is your body, when you give it the right nutrients, when you take care of yourself with optimal sleep, good exercise, low stress levels, your body has the nutrients it needs to progress through these stages optimally. When you don't have these things, when you live a sedentary lifestyle, if you're obese, if you're on a plethora of different medications, your ability to heal is probably a little bit less. And so it makes sense from maybe supplementing dietary nutrients, getting outside, getting more vitamin D, doing all these things to help bump up your body's metabolic reserve, because our bodies are naturally designed to heal. It's born within us. It's part of our innate abilities to heal. God gave us this ability for a reason. But I just think so many people have limited their healing capacity. And so this is why going over the science and what's happening on the molecular level, it's taken a lot of different cells to do this. And so you need to make sure that your body has the right nutrients, has the right environment to heal on its own naturally. When we get hurt, or when we have an injury or a cut or a wound, our body is going to be, usually it's going to be vasodilating at first from the initial injury. So our body wants to stop that. It wants to go into a state of hemostasis. So it's actually going to vasoconstrict. It's going to have platelets, little blood cells that are going to interact with collagen. They're going to clump up together and aggregate together. There's also an enzyme called thrombin, which actually forms at the center, initiates this clot to help stop the bleeding, to stabilize the wound in the bleeding process. So after hemostasis has occurred, which is basically trying to balance the blood letting, the inflammatory process starts. And so here we have different inflammatory cells. We have mainly leukocytes, mast cells, and macrophages, which are trying to clear damaged cellular debris, and they're trying to get different immune cells in here to start the healing process. So inflammation is good. We need inflammation, right, as you see right here. So maybe, taking, like for instance, when they did stem cell transplant into my ankle, they told me not to take, any NSAIDs because they actually wanted a normal inflammatory response. Does that make sense? Because they actually wanted some inflammation there for those stem cells to settle so they can migrate, proliferate, and regenerate into those areas. Okay, so you want some inflammation here. So this lasts, anywhere from, different studies have shown days 1 through 4 or days 4 through 6. And so supplements that you could be taking, the first, signs of inflammation are as follows. Vitamin D, it's got several studies on wound health, immune health, etc. Zinc, got a ton of studies on wound health as well. Magnesium, magnesium is definitely indicated for blood issues, mainly like blood pressure, increasing nitric oxide. So magnesium is a great critical factor in this. And I'm not really talking about a lot of inflammatories or anti-inflammatories. You could take some natural stuff later on, but I think there is a need for some inflammation in the first couple of days that your body actually needs. Okay. Okay. So after that first week, maybe after that first 4 to 6 days, now you're entering into the proliferative phase. This can last, up to 21 days. So this is kind of where new tissue is starting to lay down. We're trying to get rid of that damaged tissue, which happened in the first inflammatory phase. And now we're trying to, get that old tissue out and maybe start laying down some new tissue, some new collagen, right? So this is going to lay down fibroblasts. They're going to start laying down collagen in the wound bed, strengthening up the new granulation tissues. The wound edges, wherever they were, are starting to fill, and different cells are starting to migrate to this area to start the healing process. Okay. In this phase, I'm going to do a separate video on all the different nutritional factors I'm personally taking after my surgery, but this phase, you can do vitamin C. It's water soluble, which you can spread it out throughout the day. You could also maybe start to doing some collagen. You could also start to do some proteolytic enzymes, which are going to help aid in, the removal of, scar tissue and debris. You could also start doing collagen. Collagen is another crucial cofactor, but also I think don't neglect the fact of nutritional factors like protein. Definitely get your protein up. Your body's trying to heal, so it's going to be squeezing out all the different amino acids it can so it can start to heal when it's going through the proliferative phase and also into the maturation phase, which we're going to talk about next. Okay, so day 21, 3 weeks out from injury to 2 years is the maturation phase. So this is actually probably the most important phase in the healing process, and in fact so many different factors can impact this. Your nutritional status is one. Your age, your physical activities, your physical abilities, your physical limitations. Again, what activities you've done in the past, what have you not done in the past. They can all impact this. So here is where your body's actually starting to mature. Those collagen fibers are starting to reorganize. They're starting to cross-link. There's different enzymes that are involved in collagen cross-linking, like vitamin C and magnesium. So that's why you want to be taking those. You want to have a good nutritional status. You don't want to be deficient in any vitamins or minerals during this phase. You also want to be making sure that you're getting lots of protein. You want to limit the amount of scar tissue that's formed as well. So that's why I like to use, proteolytic enzymes. Serrapeptidase is one that actually has been shown to eat away at scar tissue. But make sure you're getting lots of vitamin C. Vitamin C is an antioxidant. It's actually been shown to actually limit the formation of scar tissue in some studies. Magnesium, of course, if you're going through a stressful situation with an injury, magnesium is getting depleted, so we need to replenish that through supplement or through the diet. But here, there's a lot of different factors that occur. One is, what kind of motion are you doing? Are you actually physically moving that injury? Are you seeing a physical therapist or a chiropractor? Making sure that everything is moving, because there's a thing called Wolff's Law and David's Law, which states that the more stress you put on a tissue, the better it heals in that position. So if you have a joint that you don't move, well, it could stay stuck. But if you have something that's moving, your body's going to lay down tissue to allow you to still do those motions that you're telling it are safe and that are good for it. I hope that makes sense. But anyways, maturation phase is where I think a lot of people can get messed up. Maybe they think they're feeling good. Maybe they think the injury has healed, but it's still not completely healed, because this collagen is still constantly remodeling. And a lot of studies show that once you have an injury, your collagen is only about 80% as strong as it once was. So that's why I think taking the nutritional side of things can actually bump up and bridge that 20%. So collagen, is small. Collagen, peptide is amazing. Making sure your B vitamins are up, making sure all your cofactors from nutrition are up, making sure you're optimizing sleep, making sure you're moving, make sure that joint is, getting the nutrition needs. That's how some of our joints, if it's a joint issue, actually get nutrition, is through motion. And a lot of times, the stage of wound healing, a lot of times before we actually said it was RICE, which is rest, ice, compression, elevation, a lot of new studies are showing that it's now MICE, movement, ice, compression, elevation, because they want you to start moving as quick as possible where feasible, so that you can actually start to get those joints, muscles, tendons, ligaments to structurally reorganize in a fashion that is strong, that's resilient, and it's not as weak as it could be. So that's why you want to be doing the nutritional factors along with the physical to have a great outcome with the next injury or the next trauma that you may occur later on in life. Anyways, I'm Dr. Robert Fredrickson. I hope this quick video was helpful on the stages of wound healing. In the next video, in part 2, I'm going to be going over the different nutritional factors that I'm personally taking to optimize my nutritional intake from my ankle injury. So hope you guys appreciate this video. I know it was fun making it, and we'll see you on the next one.